How's it going, everyone? I'm Leslie the LMT, back again with another video. Today I want to show you how I foam roll my lower body. I'm a jogger, and this sequence addresses the structural imbalances caused by running and jogging, but overall it is a perfect short set of moves to address lower back pain. So you will need a foam roller. I happen to have a longer foam roller, but I'm not endorsing any particular kind. Most kinds of foam rollers should work for this. So adjust any of the moves to meet your level of strength, balance, and flexibility. Don't continue with any motion if it doesn't feel right or if it causes pain or discomfort outside of the sensation of the foam roller on that particular part of your body. So set yourself up on the floor however you need, and from my heart to yours, please enjoy this offering. Thank you. We're going to start working down the front of the thigh. Do a simple lunge over the foam roller. If you need a modification, simply work both legs at once in a push-up position like I'm showing. If lunging goes beyond your range of flexibility, strength, or balance, or the sensation is too intense doing one leg at a time. If you're lunging with me, starting just above the knee, use your body weight to sink into the front of the thigh, letting gravity slowly roll you up the length of the muscle. As you roll, this will deepen your lunge. Before going beyond a comfortable stretch, you can heel-toe your front foot towards the back foot to shorten your lunge. If it works in your body, you have the option to bend the back knee like I'm showing to increase sensation. And if the lunge alone is enough at first, that's fine too. Just work well within your limits. See how I heel-toe the foot here to keep this stretch safe and comfortable. I'm fully supporting my upper body with the arms and the front leg here, and I'm using a rocking motion, working in sections all the way from above the knee to just below the hip. If you find a tender spot, see if you can linger on that point and let gravity in the foam roller dissolve it. As long as you're within your limits of a comfortable stretch and keep the sensation at or below an 8 out of 10, you can trust that this temporary discomfort means longer-term pain relief. See if you can breathe through it. As you get closer to the top of the hip to allow space for the stretch and reach this area from a lunging position, you can let the front foot and ankle gently roll out so the knee can relax to the side and bring you more forward. But go slowly, and if anything doesn't feel right, just ease up. Always stay within your limits. We're going to come out and switch sides. With foam rolling, you're doing a lot of lengthening in the body, so as you come out of any position, go very slowly, taking pauses for the body to adjust and avoid injury. Make sure to fully re-support yourself as you come up slowly. Switching sides, do a simple lunge over the roller and place it just above the knee to begin. Try to maintain really solid form in your lunge, protecting your joints at all times. If you need to shorten your stance, remember heel-toe the front foot towards the back. Slowly rock over sections of the muscle, working from knee to hip crease on this side. You can linger on any particularly tender spots and use your breath, gravity, and the roller to release them. As you get towards the top of the thigh at the hip, and only if it feels right in your body, you can let that knee fall to the side to create more space. If you would like more sensation and it feels okay in your body, you can bend the back knee to create a pin and stretch effect in the thigh and create more intensity. Don't be surprised if the second leg is a brand new experience from the first with regards to sensation, flexibility, and so on. Be sure to pay attention to your upper body too, and make sure you're not shrugging the shoulders up by the ears, locking the elbows, or carrying unnecessary tension in this area as you work the lower body. We're learning to touch in with our body mechanics all over, even though we're focusing on one part. We don't want to work to release one part of the body if we're doing it at the expense of another. We're going to slowly come out, pausing to re-support yourself and let the body adjust before coming up to stand. Let's work the IT band, starting to the side of the knee and working up to the hip. You'll support yourself in a side plank position, bending the top leg with that foot on the floor for support if needed. This is a commonly tight and very tender area, so find a way to work that allows you to keep the sensation at or below an 8 out of 10 here. I find it comfortable to come down to the elbow of the bottom arm here, and I'm demonstrating how to create that kickstand with the top leg if you need extra support. Keep making adjustments to adapt to your position on your roller. When you get to the top of the hip, remain there and rock the top hip forward and back to work the tensor fascia lata on the bottom hip that's against the roller. The TFL is the muscle that moves the IT band. This is likely to be very tender, so go slowly. Re-support yourself, then start to pass back down from knee to hip. If you can tolerate it, linger on any tender spots to try and dissolve them. The breath is your ally here, as this can be very intense, but this tendon, the IT band, is often involved in the complex of factors in lower back pain, and it also can create pain and dysfunction in the knee joint. So, as sensational as this may be, the ultimate relief is so worth it. I'm trying my best here to keep the joints of my upper body stacked and supported. Notice the active position of my right hand and forearm, which I'm doing to protect the elbow and shoulder joints, keeping them hugged in. The IT band gets a lot of attention these days, but underneath it is a muscle called vastus lateralis, which gets very tight in us runners and is a huge culprit in lateral knee pain. Rolling this area is going to have a greater impact on the muscle than a tendon like the IT band. This muscle is commonly hypertrophied, which is just a fancy way of saying very taut, hence the sensations you're probably feeling as we work. Take a few more moments on this side, then slowly and carefully, supporting yourself, stand up to switch sides. Find your way into a variation of a plank that's best for you on the second side. Start to the side of the knee and work your way slowly up towards the hip. Your upper body should be strong and steady to support you, but remember, you don't need to tense up, shrug your shoulders, or sink into poor posture to work the leg. Check in with your total body alignment. As you reach the hip crease, stop and do that rocking motion with the top hip to compress and release the tensor fascia lata on this side. What's most comfortable for me is to bend the top knee here and just use it to direct the activity. When you're ready to move on, you can start your pass back down towards the knee. You're crawling along with this motion in the upper body to keep your elbows stacked over the shoulder. Always pause and get some extra cushion for the floor if you had hard floors like me and it's bothering you. Make everything else as comfortable as possible. It helps us to cope with the discomfort caused by working tight and tender muscles. Remember, if leaning your full weight onto the roller is too intense, you can always take that top leg down to the ground like a little kickstand to assist in taking some of the pressure off the side of the leg. As you repeat this foam rolling sequence for the lower body, you'll be addressing these hypertrophied areas in ways that stretching does not. If you keep at this, you will find that each time you're able to handle more pressure, and after a while it won't hurt very much to work the IT band area. Take a few moments here, then slowly come to laying with the roller right under your hip crease. Ease onto the front of the hips and abdomen slowly, and you may need to hold yourself slightly off the roller if the sensation is too much, or if you feel a really intense pulse in your belly. Your abdominal aorta is the main artery that carries blood from your heart to your entire body, and it runs right through here. You'll know it if you're pressing on this aorta, so just adjust to where you're getting a compression in the front of the hips, but not getting that sharp pulse. It can be a little tricky. Don't be surprised here if there is an intense referral pain to the lower back, like a strong ache. This is normal, and it means we're addressing trigger points in the hip flexors that contribute to your lower back pain. Notice my pelvic tilt is pretty neutral here, not swayed back or tucked under. Dumping in the lower back will be counterproductive, so keep the abdominals slightly engaged. If you can find that sweet spot where you're not pressing on your abdominal aorta, but you're feeling the spike of referral pain in the lower back, you're likely hitting the psoas. Because it runs so deep in the abdomen, this hip flexor is notoriously difficult to address, but it is a huge culprit for lower back pain. Keep sensation at or below an 8 out of 10, and that goes for the local pain and referred pain you may be feeling. After initial flare, the sensation should die down, at which point give it a few more moments and then seek out a new area to dissolve against your roller. You can bend at the knee and move the feet like a windshield wiper to rotate on the pelvis side to side and hit different angles of the hip flexors, abdominals, and even touch on the obliques. Likely because of the amount of hours many of us spend sitting during the day, gluteal amnesia is very common in our culture. It basically means the glute muscles go slack and forget how to fire and engage appropriately where they're needed. In squatting, for example. This causes us to over-recruit muscles like the psoas and the quadratus lumborum, or QL, which is a deep side abdominal muscle. Rotating and compressing the side of the waist can help release the QL. Take a few more moments, then slowly re-support yourself and come into a cobra stretch, pausing to let the muscles readjust before attempting to come fully up. Come sitting on the foam roller with your legs out in front of you and the roller right at the crease where the hamstrings and glutes meet. Rolling both hamstrings at once like this is a modification you can take. Otherwise, swing one leg around and onto the floor so that you're targeting the hamstring of the opposite leg. You can have the knee in a deep squat like I'm showing. You can bring the foot forward to an easier bent knee, or all the way until the heel is on the floor. The further the foot comes forward, the more limited your range of motion here, so choose whatever level is appropriate for your body. We're really targeting the top of the hamstrings where they meet the glutes and the belly of the muscles, so ensuring you're carefully supported by the upper body and your bent knee is staying safe. Rock back and forth over this area, trying to get as much pressure as you can handle, but staying at or below an 8 out of 10 on the sensation scale. Take a few more moments, then carefully switch sides to work the opposite leg hamstrings. Notice how, if your non-working leg is in a deep squat like mine, my foot is angled out to the side, which just creates optimal space and alignment for the joints. Remember your modifications here with the non-working leg. You can always bring the foot forward to change your experience in the bent knee. I like a deep squat in my non-working leg because it just gives me more leverage, but do whatever feels right in your body. The hamstrings are antagonists, or opposing muscle groups to the front of the thighs and hip flexors, so it makes sense to work both evenly as each group of muscles affects the range of motion of the other. Slowly come off the roller and prepare for another passive compression. This time, we'll drape the side waist over the roller to really target that QL muscle I discussed earlier. You're simply going to lay across your roller, placing it in the curve of your waist, and prop yourself up on one elbow. Adjust the amount of pressure to whatever feels right in your body. To go even further with the stretch and sensation, kick the top leg out in front of you and the bottom leg behind to slightly scissor the legs. Slowly rock back and forth, exploring different angles of the obliques and QL. If you need more pressure here, you have the flexibility, can keep your knee safe, and it feels okay to you, Grab the opposite knee with your top arm to give yourself better leverage and increase the stretch in the psoas, QL, and abdominals. The QL is a major contributor to low back pain, and when tight, creates compression in the spine. Because this muscle lies so deep, stretching will only ever really get at the more superficial muscles, which makes foam roller compression a much more effective means to address this critical muscle. The QL is a deep core stabilizer muscle, and we've been here for over 2 minutes. So it's very important as we look towards switching sides that you come out of this position incrementally, pausing, fully supported by your arms, and allow the muscles to adjust and be reoriented before moving on, so we don't risk throwing out our backs. Just do it in stages, holding until things feel more consolidated, and then keep moving slowly back up to sitting. Come up slowly, and once you're upright, pause before switching sides and let this side waist fully hang like a hammock, supported by your arm on the floor for a gentle stretch. Now switch sides so that the curve of your opposite side waist lays across the foam roller. Slightly scissor the legs, bringing the top leg forward and the bottom leg back. Remember, if you have the flexibility, and only if you're not feeling much sensation at this level, you can bend the bottom knee and hold on to it with the opposite hand for greater stretch and leverage. Resist against the hand slightly with the foot to stabilize and protect your joints. Because it is a deep abdominal muscle that stabilizes our posture, we use the QL whenever we're sitting, walking, or standing, basically all day long. As such, the QL is involved in a whole host of compensation patterns where it has to make up for lack of strength in other muscle groups in the lower body, the trunk, and the upper body. So you can imagine most of us have very overused and tight QL. Working this muscle in massage therapy is like a key that unlocks so many issues in the body because it's so central. Again, because we've been holding here for a couple of minutes, there can be a feeling of fragility as you begin to exit this position. Just go slowly and let the body settle and adjust before coming to sit upright. Pause to this side and let the side body hang for a moment here to give this area a nice gentle stretch. Come sitting up and slowly and easily twist side to side to lubricate the spine a little bit here. Moving on to the glutes, Come sitting on the foam roller with one foot on the floor and cross the opposite ankle over the bent knee. From here, making sure to support yourself and keep your balance, you'll simply rock back and forth over the hip, exploring tender spots and lingering wherever extra attention is needed. If you need to modify, you can keep both feet on the floor and roll both sides of the glutes at once. You won't be able to cover as much territory, but it is better to take the modification and protect your knees, muscles, and tendons. I have a lot going on in my glute minimus, so I'm rolling towards the very top of the pelvic bone and hanging out there. Just feel around and stay on any spots that are reactive to try and dissolve the tension and trigger points there. In the very center of the glutes is a muscle called the piriformis that I've discussed in other videos. You will probably find a good deal of tension there, as most of us have a tight piriformis, if not full-blown piriformis syndrome, where some degree of nerve compression is involved. In general, the center of the glutes is an important and effective area to focus on. Slowly come back up to sitting, put both feet on the floor, and switch the crossing of the ankle to work the second side. If you're taking the modification, just keep working both sides at once here. There is a main nerve plexus that runs down the center of the glutes, and our muscles can get so tight here, especially the piriformis, the deepest muscle in this region, that they put pressure on these nerves, causing various pains in the leg or even the foot, and sometimes numbness and tingling. It's important to keep this area stretched and release tension here to prevent and relieve a common source of lower body discomfort. Take a few more moments here, exploring and lingering on any tender spots you find. Come slowly out of this position, and we're going to finish up this sequence by simply rolling over the whole back in whatever way feels good for today. Simply lay with the roller at your back, feet on the floor and knees bent. You'll need space above and below you to move up and down over your foam roller. Feet are active, pelvis is very slightly tucked, and abdominals are engaged to prevent injury. I have my hands behind my head to support my neck here, almost like a crunch position. Roll the length of your back, giving extra attention to any area that feels needed. I like to drape my upper back over the foam roller to stretch my chest and sides of my waist. Keep the slight engagement in the abdominals and let the body gradually sink into the ground and roller only as it feels safe and comfortable. If you're taking the stretch, the legs can come to rest straight out in front of you. Use the elbows to come up, roll out the back a moment, then position the roller across the back of the shoulders for greater stretch through the chest. Support the head as needed, and gradually lower it to the ground to where it feels comfortable. carefully come up to sitting, you are done with this foam rolling sequence for the lower body. Thank you so much for joining me today for some practical self-healing arts. Commit to doing this practice regularly and you will find greater freedom and alignment in your body. Please subscribe to my channel for more resources on becoming your own body worker. Thank you.